Hi, good afternoon from Florida, Texas. Um, all right, where do I begin? What is nursing leadership at the bedside? Is it the manager who comes in, gets the team together, and discusses a few things that have occurred for the unit or in the hospital setting, getting ready for huddle? Or is it the charge nurse who puts together the assignment for the day or the night, depending on it's a night or day shift? Is it the nurse at the bedside who needs to uh, prioritize and figure out what the day is going to be about and lead how she's going lead her workflow for the day and with whom she needs to collaborate with for the patient that day? Is it the doctor who needs to change some medication orders or physical activity orders for the patient and has to bring this into the conversation to give the plan of care for the patient, but also for the nurse? Sometimes even for those that are collaborating with the patient's care. Or is it the case manager who needs to discuss with the nurse and the patient and the doctor what's going to be the plan of action when the patient goes home, if they need any assistance? Is it the housekeeper who is coming in to clean the unit and needs to wait and collaborate with their supervisor to see which beds are going to get cleaned first or second? Or maybe speaking to the nurses to ask, hey, will this patient be going home, so that they can prioritize some beds over others? Is it the physical therapist who needs to collaborate with the nurse? The list is endless. The list is endless with who takes leadership at the bedside for a patient. Who is the leader? Everyone is the leader. Everyone is the leader. Even the dietitian techs who come and leave the trays at the bedside for the patient, they need to, figure out where they're going to leave the tray, make sure that they take the trays on time, that it's not too cold, to pass out the coffees first, and who is on a clear liquid diet and who's on a fluid restriction diet. Like, they also have to know these things. They have to take lead on what questions they need to ask so that the patient is safe, so that the orders aren't changed, because whoever the patient encounters, they are a leader. Any patient encounter needs a leader at the bedside. And I think anyone everywhere is a leader. Now, when you start discussing what kind of leader are you, well, now you're kind of diving into, well, I'm the kind of leader that leads and manages as a leader, maybe teams, maybe finances, maybe just mostly teams. That's where leader to be a leader is in places where someone is a team leader. But everybody is a team leader, and I think that we forget that, and we start as a team leader, maybe we start feeling like, oh, I'm the team leader and I say as it goes. But I think we forget that to include everyone as a team leader. Maybe there's a title to kind of help those who don't believe in that, and to push them up. I don't know. It's difficult to say. One of the examples I'll bring up is shared governance. Sometimes they'll have unit shared governance or unit councils for specific units. The hospital has many of these different units, whether it be ICU, emergency room, med surg, anywhere where there's nurses that tend to be the that mesh before you get to a patient sometimes. And I believe that coming together as a unit is one way of really finding out what the unit needs. And sometimes that unit is a person in itself, because that unit might specialize in maybe, let's say, special surgeries that they're very familiar with the policies and procedures on how to do these things. But today we're in a place where even if it's a specialized unit, right now the turnover of patients is so high. No matter whether I worked from one side of the states to the other side of the state, from the west to the east, and working in central, it's the same everywhere. You can specialize, and things that were pretty specialized before COVID, but now it seems specializing has kind of, it's taking time to get back to how things were before COVID. But now the reality is that we're kind of all mixed all over the place. And, I remember this year just going into different units and seeing that they all had these great trophies and we are the best unit and this and that. And all of them were before COVID. And after COVID, I don't know what happened. If you do sort of have an idea or theory of what happened, let me know. But the focus here is leadership. Leadership has changed since COVID, and there's a lot of exhaustion. There's a lot of exhaustion in leadership right now, and a lot of push, because anyone who looks up what a hospital is, it's an ever-changing dynamic system. It's always changing. But guess what? So are we. We are always changing. And we forget to treat a hospital as a person. Like, what does it need? What does it need? The people is the energy. The people in a hospital are the red blood cells that carry the oxygen. It has a life. If it didn't have blood, if a hospital had no blood, no people, there wouldn't be any hospitals. But in today's age, there's hospitals everywhere. Now, there are a little bit of things that occur in understanding what a hospital is. Like, if you ask someone who's been in a hospital, had a bad experience, or they don't really understand, they think a hospital's like a bad person. It's a bad place because, oh, well, I went in for just a checkup and I ended with half my leg taken off and my heart replaced and a big, huge bill, and my insurance, I don't even know how insurance works. So it's like a big, huge mess. And I don't know that there's a leader who understands how to get all this together for it to make sense. Like, people want to know, how can this make sense? And maybe I do. Maybe I want to know how this makes sense, because even as a nurse, I couldn't even explain to a patient how something worked. The insurance, the surgeries, questioning like, well, why does this patient need this? And then suddenly it becomes this huge question, like, does this patient really need this? And how can I advocate for this patient? But then my specialty or what I specialize in might have a gap that doesn't understand why this patient might need this procedure or surgery or medication. And that's scary. That like, doctors could say, I don't know that we're really a health care anymore. I think now we're just a disease care. We're just caring for diseases. In a hospital setting, it's just not. We try to make it hospitable, where you make the places look like hotels, you make them look nice, and the staff can be so kind and so generous, but going from working in a private sector to a public sector, in the private sector, yes, we're going to take care of you. It's fantastic, everything, because you have insurance and you have really good insurance. We're going to do everything we can. We're going to treat you like such awesomeness. And then you run out of insurance. You lose your job. You don't have any coverage, and because you just you got so sick that you were in that private sector, and then they took care of you so well, and then you end up in the public sector, where it's packed. It's not the same kind of care. It's very different. And suddenly you're having to trust whoever is there to provide the kind of care that you need at that time because you're at ends meet. Like you don't know what else to do. You had all this hope when you had money, and now you don't have money, you don't have much hope. Like, how does that, no money, hope, no hope? But that's one view, right? There's many views. And seeing that is very interesting. There's a book, The People's Hospital. I'll get the guy's name. I'll set it in the link. And he sort of touches on this, how, in the public sector versus, and then meeting and working with patients who are in that area where they were doing everything they needed to do, like going to the doctors and getting checked up, and they couldn't figure out what's going on until their insurance went out. And then now they end up in a different place where now we got to find different things to try to care for this person because they're almost about to die, and we have to find a way to get them to live. And where's the leadership in any of this? I don't know that I see it. Like, suddenly it becomes a system. But is this a system that's working for the people? It works for the people, yes. It keeps them alive, keeps them in the hospital. But now we're keeping them in the hospital. We want to do as much as we can, but now we got to kick them out because there's other patients that need to come in. And why suddenly are we having such a huge population of sick people coming in and wanting to be in the hospital? Is that a leadership question to ask? I believe so. I think we have a responsibility for those of us who decided to get into healthcare to ask those kinds of questions. I mean, if you ask yourself, how do I help? And you're a nurse and you're working on a unit. And if your answer is, I can help by showing up. Fantastic. I congratulate you because I've been there. I've felt that, short-staffed. Suddenly you get there and you realize, okay, I'm not going to have my 4 patients. I'm going to have 5 because we are short-staffed and we have to figure out, see if we can get someone to come in. And you're making phone calls to everyone who can come in and to try to help out the staffing. And, but then you just truck through, right? And we're just so focused on trucking through and we forget there's other things we need to focus on. Like, it's just endless. Well, what's the solution? Well, I mean, what were things like before COVID? What were things like when you could actually help a patient out? Where suddenly it's coming to a point where we have to teach patients how to take care of themselves because they've become so dependent on the system, so dependent on us to care for them, that they're not caring for themselves. Like, okay, I can work my whole life and shit hits the fan and now I have to throw myself into a hospital and do something, fix me now. What are we doing as a system to help patients not get to that point? What are we doing as leaders to not get, going back to inpatient staff, not so much patients, but inpatient staffing? How do we get to the point where we prevent them from wanting to quit their jobs, from them feeling like they can't sustain their workplace? Like, remember, it's a system. And so if we want our patients, how do we help those patients if we can't even help our staff, the people who are actually providing this care? Sure, we can do public health, community service, but sometimes a lot of things we learn is through word of mouth. And if you have a hospital system that has leaders that are exhausted, then how do you think the rest of the people outside the hospital are? They're exhausted. It's kind of interesting, but very complex. Some of this might not make sense. It might sound like I'm rambling on, but I'm rambling on about the whole view of everything. That it's not just, I'm coming here to just speak about nurse leadership, but as nurses, we have the power to make a difference. And I still trying to figure out how to make a difference. And if you have something to suggest on how to make a difference or what's worked for you, let me know. I'd really love to talk with you because sometimes it feels, I wouldn't say helpless. It used to feel that way. The helplessness, and that was during COVID and a little after, no, not so much after COVID, but it was during COVID. A lot of people felt helpless. Like they wanted to be there for their teammates. They wanted to do what they had to do to get through the day and to do whatever they could for those patients that needed them. And we collaborated with everyone all over the hospital. Everybody collaborated and came together to help each other out, do whatever it took to do just that. But after that, it was like the sense of comfort that, it's over and we can go back to how it was. But that's not the reality. And it seems a lot of people are still stuck on that idea that things will get back to how they used to be. And it seems like they're just the same as they always have been. And that's okay. But at the same time, they're the same as they always have been, but like times 100, if that makes sense. Like it's how it used to be, but times 100. And how is that the same? It's difficult to say and to come up, but it's like nurses who were nurses 20 years ago, they're like, they'll mention how much more work there is now. And I don't know if that's just it's just how it always should be, and we should just keep doing what we're doing because that's working for us now. Yes, it works for now, but that's like putting duct tape on something. Yeah, it works now, but that duct tape will only last so long. How much more duct tape are you willing to put on there as a leader? A lot of this can be controversial. Yes, I get that. But does it have to be? Can we actually get together and talk about what can be done? As mentioned, this is a complex topic, and if you have anything to say about it or any input, please leave something in the comments and let me know what you've encountered. We can think of certain things, but some of the things that we think about is because we encountered something. So let me know what you've encountered. You don't have to mention hospitals. You don't have to mention people. It's best to talk about what you're seeing, what you're encountering. And perhaps the vision is miscued and perhaps it needs a little clarity. And the only way to get better is to come together, right? And to collaborate. But I'm still trying to figure out how to do that. And if you have any suggestions, let me know. I know there's so many, like being part of an association, doing this policy, doing that policy, and I get that. And everything takes time. But time is of essence. We are hemorrhaging as a healthcare system, and everyone's just putting fucking band-aids on it. Am I the only one seeing this? Because if I am, go ahead and leave it in the comments. That's fine. If I'm not, let's talk about it. Let me know what you've encountered. Let me know what you see. We could be totally wrong, or if we're right, what if we could change how healthcare works as leaders, as people who want to care for the health of others, as healthcare entails. And if you want to work, and if you want to help people with a disease, then care for that disease. But in the end, once you treat that disease is treated and that person is healthy. How do we continue to care for that health that they've now obtained after treating their disease? Yeah. Thank you for listening. I'll leave some information in the description box. Please let me know if any of this resonates to you. If it does, fantastic. If it doesn't, don't worry about it. I'm just very curious. I want to know what's going on, and I'm a little lost. And I want to see if there's a difference to be made. Thanks.